Welcome to another installment of Orange County Economic Development's Small Business Survival Kit. Today's episode is focused on operations technology. Welcome, my name is Bill Fioravanti. I'm your Director of Economic Development here at Orange County, and thank you for joining us for another episode of the Survival Kit series. The whole intent of this series is to provide you with tools, resources, even people that you could reach out to for assistance to help you not only survive through the COVID-19 pandemic, but to help your business thrive. We have a wonderful guest here who's going to talk about operations technology and how they pivoted their business during this time. But before we get to that, as always, I want to start with a few updates. First of all, reminding you about our economic response team, not only myself, but Amanda Dana and Steve Knob, who are my fellow directors here at Orange County. We've been manning the phones and responding to businesses of all types and all sizes who have struggled during this time and need assistance of one type or another. Please reach out to us in person, call us, send us an email if you need help with any financial situation, unemployment questions, how to reopen your business safely, or any other concerns you may have. We are here to help. We have been here the whole time. You are not alone in this. So we want to make sure that you reach out to us for the help that you need. We have not provided that help alone. We have a safety net of fellow agencies throughout the county and throughout the region that have helped us support our businesses when they need us most. We certainly want to thank them for that. Our guest today is Sandra Cassese. Sandy is the Chief Operating Officer for Hospice of Orange and Sullivan counties. It's a tremendous interview, so I certainly look forward to sharing that with you. Before that, just a few other COVID updates. First of all, Orange County is entering phase 3. It's an exciting time. We have been reopening for several weeks now, about 4 weeks leading up to phase 3 opening now. And it's been a much more exciting time, certainly than the most scary times that I think so many businesses went through in the beginning. Now we are seeing the light at the end of the tunnel and getting back to a sense of normalcy to a degree. With phase 3 opening, we seem to be getting even more back to the normal kind of scenario that we're used to. With restaurants opening indoors again. So let's tell you about some of the details with that. Business is permitted to open as of the 23rd when this webinar is airing for the first time. Again, indoor food service. We've been able to patronize restaurants outside. And thank you to so many folks around the county that have been patronizing your local restaurants and stores and such. We have seen a tremendous boom. It's been great to go around the county and see our various restaurant rows thriving. So that has been a great thing. But now, as of the 23rd, you'll be able to go back inside to dine. Of course, there are restrictions. You need to be wearing PPE when you're not at your table or seated at a bar. Tables do need to be at least 6 feet apart. And again, parties at a bar need to be 6 feet apart. And there is a capacity change for business owners, for restaurant owners, pardon me. And I hope many are listening because this is an important distinction to make. You're able to operate at 50% of your capacity, but not your capacity based upon your seating capacity. So if you maybe have 50 seats in your restaurant, that's not what we're talking about. We're talking about your occupancy based upon your certificate of occupancy that you're granted before you open your business. So your CO may say that maximum occupancy is maybe 60. So you would be operating at most at 30 seats, half of that. Typically, your CO occupancy is higher than what your seating capacity is. So that's a distinction we certainly wanted to make. It's important for you to know. In addition to restaurants indoors, we have nail salons, tattoo studios, massage therapy, aesthetic services, tanning, and low-risk sports that are opening up here in phase 3. Let's talk about what's not yet opening. Unfortunately, the following seem to be all headed for phase 4. Indoor gyms and fitness centers. I'll get back to that in a second. Indoor movie theaters, arcades, bowling alleys, and most types of amusement and entertainment venues. Going back to the gyms, there has been recent updated guidance from New York State that is going to allow outdoor fitness programs during phase 3. They won't have to wait until phase 4, which looks like it's going to be July 7th. So that's important. Your gyms, not only is it important for the businesses, but so many of you out there that really depend upon going to your local gym to not only stay physically fit, but mentally fit for that matter. So you're going to be able to do part of that with being able to go outside now and have those classes there, but indoor is not yet open until phase 4. For any questions you may have about reopening, we encourage you to go to the webpage for Reopen Orange. You go to the Orange County website at orangecountygov.com. You'll find our COVID banner there. On our COVID page, you'll see a number of resources that help businesses and individuals through this time. And you'll also see the Reopen Orange button, which is the image on the lower left side of your screen there. You click on that, and we provide a number of vital resources to you, including a comprehensive guide on reopening your business safely, a toolkit that you can post in your workplace, share with your employees and your customers, that outlines the steps that you're taking to keep them safe. And we also have on the Reopen Orange website links to various New York State resources, including the New York Forward website, which we're all following every day, looking for updates to help you reopen. Let's talk about the financial side as well. Everyone knows about PPP. That's the Paycheck Protection Program. That has saved many of our local businesses. One of the challenges that businesses were encountering, were the forgiveness rules, because it is a forgivable loan if you play by the rules. But some of the rules were challenging for our region, for businesses like restaurants that are just opening up. Those rules have been eased. It's much easier to qualify for forgiveness. We won't go into the details on this show. We did the last episode, but call us, email us, use social media, the website, whatever means to get to us if you have any questions about it at all. PPP loans are still available. I want to continue to stress that. However, there's a deadline. The Small Business Administration needs to have those applications by June 30th. That's coming up. So you need to go through a local bank, and that bank needs to turn that application in by the 30th. So most banks are accepting applications for PPP loans only up until June 25th. So be advised, it's only a couple of days away as of the first airing of this webisode, which is on the 23rd. So please, if you don't have a PPP loan in place, if you're not sure how to get one, if your bank isn't lending, whatever the challenge is, reach out to us. We'll help connect you. Make sure you know about the banks that are still lending and lending to customers who are not their own right now. That is happening. So that's important. Okay, we're going to bring in our guests now. Very, very excited to have with us today Sandra Cassese. She's the Chief Operating Officer for Hospice of Orange and Sullivan counties. Sandy, thanks so much for being with us today.
I am delighted to be here. There's a lot to talk about.
Absolutely. Hospice went through a lot, as did so many other organizations here, especially human services organizations like yours during this pandemic. And so we want to learn from it. We, of course, as this is why you're here and why you're so excited about participating, I know, because you learned lessons that can be passed on to other organizations, not just nonprofits, but small business as well. And of course, big segment of who we're trying to reach with these webinars.
Yeah,
so thank you so much.
Some lessons. That is a true statement, and it's good that we share this with one another, don't you think?
For sure, absolutely, no question about it. That's why we're doing it, and so glad that you're here. So before we start, let's just talk about yourself, please.
Sure.
Can you tell us a little bit about your background, even before hospice?
Sure. So I'm a registered nurse by occupation. I have a master's degree in community health. So I've always been very interested in what we now call population health. So most of my career was spent in the oncology service industry. So I was the vice president for a large hospital system for the oncology service line for many, many years. And of course, being in oncology, the door was always open to hospice. And I had a personal experience with hospice a few years ago with a family member. And it sort of made me rethink my career goals. And it's very exciting to me that Hospice of Orange and Sullivan counties invited me into the family in November of 2017. So I've been there about 2.5 years.
Wonderful. Great. You just touched on something that I learned only probably 20 years ago now. I didn't have a lot of familiarity with hospice, but through my nonprofit work, I actually met folks like Janice Valentino, of course, a mutual friend of ours, and learned about hospice. And I learned that hospice it sticks with people when it touches your life. It stays with you, and it's special for a long, long time. So. And I've learned that and learned more about your mission. But for those that don't have that experience and who weren't touched personally by it, could you just briefly describe what the hospice mission is generally, and then maybe take us to talking about how you execute it locally in terms of operations, which of course is your focus.
Sure. So the hospice in general is there to provide support at end of life. That it is emotional support, physical support, spiritual support. And in hospice of Orange and Sullivan counties, we represent the two counties, obviously. And honestly, our goal is to make sure that any patient, any family that should avail themselves of our services does. And so, in the strictest sense of the word, generally people are appropriate for hospice if their provider, their physician, has deemed that their illness would probably have a 6-month or less prognosis. So the way that you get on the program is that your physician certifies that in his or her best estimation that that's what the outcome will be. And so for some people, they begin to think of it in more of a gloom and doom situation. We look at it much more optimistically. Hospice is there to improve the quality of life of patients and their families. And for many of our families, they're shocked to find out that the patients outlive their prognosis. And it's largely because we come into their home, the nursing home, the hospital, whatever setting that they're being cared for, and we're able to bring them some meaning to their life. They do life review. We're able to support their symptoms and make sure that every day is their best day possible.
Well, that's when I talk about it touching people's lives. Those are the stories that I've always heard, that it's a doom and gloom scenario, as you said, but people take a lot of positives out of how you improved their loved ones' quality of life at the end or extended it, as you said. So that's clearly why it has such a lasting impact on people, families of people that you serve. So now talking about really what your responsibility is as chief operating officer, the operations, how do you execute that? Can you just give us a sense of kind of the scope of your operations, and then we'll move into how you had to adjust during the COVID period?
Sure. So obviously, we're not for profit, and we serve about 150 to 155 patients a day. And our employees now, we're at about 165 per diem part-time and full-time employees. We service all of Orange and Sullivan counties. And as I mentioned before, our job is to go wherever the care is needed. So we have contracts with many nursing homes, in fact, just about every nursing home in Orange and Sullivan counties. We work with the population in group homes. We also see patients in the hospital. We do what's called general inpatient care. And we also have a hospice residence in Newburgh. It's an 11-bed facility. And that is reserved for people who are closer to the end of their life so that we can make sure that they have a very peaceful ending surrounded by whoever it is that loves them and wants to be with them.
That's the Kaplan family residence in Newburgh?
It is, and I should have said that. Yes, indeed.
Sure.
And it's kind of a rare jewel. There's only 9 or so of those in the entire state of New York, and we're
We'll
lucky
realize that.
in Orange County, which is pretty amazing.
Sure.
And it's just such an incredible benefit. No one actually is prepared for end of life. Every experience is different, and many times the caregiver burden is just so strong that at the end they say, you know what, I really need more help with this. And so happily, we are able to take care of patients in the residence. And honestly, it is just one of the most incredible experiences for families. We hear repeatedly, especially during COVID, we've been hearing this nonstop. Thank goodness we were able to be with our family member in those final moments, because as you know, the hospitals and the nursing homes were not allowing visitors during the COVID pandemic.
So speaking of COVID, was hospice like every organization out there, virtually, where you're totally, hit by it and totally unprepared? Can you tell us about that scenario?
Yeah, so really interesting, right? So I'm the eternal worry wart of all worry warts. I worry about everything, including I worry that I don't worry enough. I started hearing, about the Chinese experience with the virus, and I started to worry. And so I went to a colleague, Rosemary, who is the vice president for quality, and said, we really need to start thinking about what we're going to do, right? So are we prepared for infection control? Always. are we prepared to do things out of the ordinary always? Because there's nothing ordinary about hospice. Were we prepared for a pandemic? Absolutely not, right? I don't think any
Who
of us
was? Right.
expected, this to come down the pike. So she and I started having, little sessions periodically I would say around mid-February, and we decided that it was time to increase our PPE, our protective equipment. So we started ordering stuff like crazy. So we were ordering the N95 masks, making sure that we had enough for everybody who needed them, making sure that we had hand sanitizer and Clorox wipes and all that good stuff.
So we were a
And
little ahead of the curve on there. You missed kind of the rush on that?
I think we were, and I'll tell you, that's where my hospital training came in.
Hmm.
And actually, Rosemary came out of a hospital background also. So we're used to emergency preparedness kind of being your thing all day, every day. I would say she's the czarina of emergency preparedness for our agency, and I willingly, helped her every step of the way, along with everybody else. I mean, it's obviously a big team effort, but we said we need to sort of mirror the experiences that we had in the hospital setting. So we prepare all year long. We have a safety committee. We look at our plans all the time. We had a pandemic policy, and it's pretty good. Surprisingly,
Really?
we went through the policy, said yes, we did this, yes, we did that, yes, we did this. But again, going back to that hospital sort of training, I had worked in a situation where when we had a couple of catastrophes, we set up what's called an emergency command center. And so somebody kind of has to be the charge person, right? An old boss of mine once said, if you assign two people to feed a horse, the horse will die. And nowhere is that more true than in an emergency. One person really needs to be in control. So she and I went to our boss, to Dan Grady, and said, we need to start thinking about putting together a team in our organization. So she and I became responsible, she for more of like the nursing type policies, and I for the overall operations. So we brought together our administrative team, and we started having impromptu meetings in the beginning. And, the worrywart Sandy said, I think we need to really start thinking about having some people work remotely. So why would we want to expose people unnecessarily?
And this is, can I ask, this is still February timeframe?
So end of February, very
And
first week in March.
I see.
Now I'm starting to get nervous because I'm reading all the scientific journals. I have a daughter who's an epidemiologist who's making me very nervous every day. And I say, I think we need to have like a really good plan. So the first thing we did is we pulled out a roster of all of our employees, and we asked the management team to say, think about this differently than you've ever thought about it before. What does essential mean? Okay. Is everything that we do an essential service? So obviously, hospice overall is essential, but think about the moving parts, right? So a good example would be the marketing department, right? Would it be completely necessary for Janice to come into the office 5 days a week? Of course not. She could work remotely. Right. So we went through that list and we came up with, I think, a really substantive list of people who we could begin to try to pilot working at home. And that's what we did. We called it a pilot.
Again, before the governor's order to do so, requiring you to do so. Okay.
Indeed. And, I'm happy about that because I was worried that if we didn't work out the kinks and then we were told we had to do something different, that we wouldn't be prepared. So we rolled it out as a pilot. And to our surprise, it worked like out of the gate. So we had to make sure, we had a lot of checklists. The first thing we did is we sent out a survey to everybody who was going to be working remotely. Do you have internet access at home? Do you have, high-speed Wi-Fi? Are you concerned about safety? Because we are. And so if you don't have a hospice-issued laptop, we need to get you one because we want to make sure that we're all in compliance here and we're in good shape. We looked at things like cell phones. So our policy in our company is you can use your personal cell phone if you choose to. A lot of people don't like to carry two cell phones, but Many people said during this crisis, yes, I would like a hospice issued cell phone because I want to make sure that everything we do is secure. So um, we just kept checking in with people. We would have weekly meetings with the various disciplines, this emergency preparedness team, and we would say, how are things going? And you know, there are little bumps in the road here and there, right? So we started doing things that we'd never done before. So I'm going to confess to you that hospice was probably not the most tech savvy company in the history of Orange County. But boy, did we get up to speed really fast. So we had just started looking at Microsoft Teams around at the end of last year, and a couple of our departments were using it for team meetings and to share information. And so we widely distributed that to the organization. And then we decided that we probably would want to have some of our meetings on the Zoom platform. So again, terrifying to some people, right? If you've not done that before. So it was interesting. I'm sure you've seen the commercials on TV where people goof on each other for all the crazy things that happen on a Zoom meeting.
Right.
We worked out the kinks pretty quickly, right?
And again, ahead of the curve, you worked some of those kinks out before the rest of the world was on Zoom.
Which I feel really good about. You know, listen, any port in a storm, right? So we just wanted to make sure that we had all of our ducks in a row. We couldn't meet as a team face to face, but it was incredibly important for us to continue these conversations. I will tell you that one of the things that I think we learned pretty quickly is there needs to be a beginning, a middle, and an end to a Zoom meeting. These could go on endlessly, right? And so
I think we could do a webisode just on that, actually. I think that's a good
I think
topic.
you're right. And I keep hearing a lot about, you know, Zoom fatigue and so on and so forth. My advice to everybody is think about what you're using technologically, right? So there are times where a phone call absolutely will certainly suffice, right? We've all become incredibly dependent on email. The one thing I will tell you is my email got overwhelmed very quickly during this. I was getting memos from the Department of Health, memos from the county, memos from the Memo Society. I don't know. It's just like crazy. And so I learned pretty quickly the value of a quick phone call because, again, there's a beginning, a middle, and an end, and you control the outcome of that, right? Nothing like an old-fashioned phone call.
Absolutely. Couldn't agree more. Couldn't agree more. Let me just ask you, when the actual lockdown happened, when we went to New York pause. Now, a lot of this was happening, before and maybe just during this. When that happened, you're deemed essential, though, correct? So hospice would continue operations as normal once New York pause was enacted?
So sure. So think about it in a couple of different ways. So we're healthcare, right, which automatically deems us essential.
Right.
And most of the work that we do obviously is not in our offices, right? We're in patients' homes, in like I said, the group homes, the nursing homes, the hospitals. The hospitals very early on said to us, please reduce your footprint. We would prefer to work remotely with you. The nursing homes, as I may have mentioned to you, they were under enormous stress, right? And having vendors, and we're considered a vendor, come in was another one of those stressors. We had to keep working on things on the fly, right? So one of the very first things that we did out of the gate is we came up with a letter that we sent to all of the CEOs of the hospitals, nursing homes, group homes, skilled nursing facilities, and said, we're deemed essential. We took it right from the Department of Health website, and we sent it every way we knew how, because we knew too that they were also being inundated with email and faxes and everything else. So we sent it snail mail. We sent it to anybody we could think of that we had an email address for, and we posted it on our website to make sure that the word got out to the community that we were deemed essential, and we needed to figure out a way in this crazy pause, right, to be able to continue to care for these patients and families that depend on us. So imagine it's like day one and everybody's panicked all over the place. And we hear from families out of the gate who say, I don't want anybody in my house. It's not, no offense, but I'm going to pass up hospice because I can't have people in the house. And we said, well, we actually can help with that. right? So we have the technology that if you find this acceptable, we can work with you via FaceTime, Skype, any application that somebody had. And it was interesting. I remember, like, on day 2, I spent the better part of 3 hours with somebody in their 80s, helping them figure out how to set up their iPhone, so
Wow.
that hospice was able to do a FaceTime with them.
Holy
Never
cow.
underestimate the resilience of people. I mean, it just absolutely
Right.
amazes me. And so we came up with a lot of creative stuff. So technologically, yes, we were doing things we'd never done before. We're used to going in and making eye contact and holding your hand and
Right.
having that physical warmth, the presence of us. Turns out you could do a lot of that using technology, and the families were very grateful that we had thought of that ahead of time. Now, I will also tell you, we had staff who spoke to families on the porch with the front door open. We had people who talked to people through the window, and we had every variation on the theme. People would stand in the driveway, or staff would stand in the driveway and help people work through whatever the issues were. And so surprisingly, I mean, shockingly, this worked incredibly well for us. Now, there were some families that absolutely required us to be in the home, right? They needed some sort of care that couldn't be delivered any other way than in person. So, again, technology played a big role in this. We were able to get that message out to the world, right? Through every marketing tool that we had, be it social media, you name it, we used it. The word really was to get out that we're going to work with you,
Mm.
whatever it takes. We will figure this out together, right? So we used YouTube videos to refresh our staff on how to have perfect infection control.
Ah,
It's something that we practice all the time, but nothing takes the place of a good how-to video, right? And I learned that that is something that you can Google anything and find the answer to anything. And there's
right.
a video for everything, right?
Absolutely.
So we deliver beds to our families, to our patients, oxygen, all that kind of stuff. And some of the families were saying, we don't want that company to come into our house. So guess what we did? We worked with the DME company, the Durable Medical Equipment Company. They came up with their own how-to video, how to set the bed up,
Ah,
right? So they would, in the cases where a family said, we absolutely do not want you in our house, we would deliver the bed and send the video with instructions. And sometimes our staff would go out and help. But who would have thought we would be doing this? I mean, 3, 4
incredible.
months ago, I would have said everybody was crazy. But there's a solution to every problem. You just have to think it through.
Incredible. Let me ask you a couple of the technical sides of this, because our economic development department is always focused on technology, trying to grow that sector here. So you're always looking at what are the angles here where technology kind of overlays the scenario. Um, First of all, with technology and your team, do you have an internal IT team? Do you outsource that? How do you do that? And how did that scenario work with this experience?
All right. So for years and years and years, our IT department was a party of one. And it worked just fine when we were a smaller agency. He retired about a little bit over a year ago. And at that time, again, I will admit to being world-class warrior. I said, I think we need to rethink how we're doing our IT. To depend on one person is cumbersome and worrisome. He was phenomenal and he was available 365 days a year around the clock, whatever the problem was. But you know that technology just continues to get more and more complex, right? And then there's all the concerns about safety and all that stuff. So we decided when he retired to outsource. And so we're doing that really well. So we actually have one employee through the company that we sourced with who is on site every single day. But the great part is that there's a whole team behind him
Mm.
back at their home office. So if there's any glitches whatsoever, we get the value of the entire team. And so troubleshooting concerns that we had a lot of questions about, our platforms and the safety of, using technology the way that we were using it. Now, again, I will say that major sigh of relief when we heard from New York State, from the governor, saying put people before paper, and just make sure that you're doing the right thing, and we'll respect that. So again, using technology, we were able to stay compliant. Okay, because a lot of what we do, we are looked at by the feds nonstop, right? Because we largely deal in the Medicare world, right? And so you never fraudulently want to do anything, that would get you into any kind of trouble.
Right.
And so technology, became very much a concern for us. Were we in compliance if we were talking with patients through, a video platform? And the answer was yes. I'm glad that we took a little tiny risk, because we did. Early on, we said, look, we're just going to do the right thing. All right. This is about humanity, and we need to take care of patients. And as long as we're not doing anything immoral or illegal, then we have to consider that all options are on the table.
Mm-hmm. Absolutely. How about security? How did that, I imagine that's always a concern, obviously confidentiality with your patients, but was that another consideration during this time?
Absolutely. So, we can remote in from home to our desktop with no problem. But again, we said to our staff, really the preference is that you have a hospice issued laptop when you're working at home, because we want to make sure that we're in a secure environment. The other thing that we do, and some of your guests may not have heard of this before, but we use a secure texting platform. It's called Tiger Text. And it's been around for a number of years, and it's largely used in healthcare, but I do know that other organizations use it, and it allows you to have encrypted messages so that you can have sensitive information that's being transferred, and there's no risk of it being compromised. That's a big help, because instant gratification.
Exactly. It reminds me of a Slack, an application like that, oral communications tools. So this is something, as you said, tailored to healthcare. Did you introduce this from your healthcare background to hospice, or it
So
came
no,
about else?
they had it in place when I got there, but I will say that I encouraged the use of it more broadly. So in the very beginning, they were just using it with the people who are in the field, so the more professional staff, the nurses, the social workers, et cetera. I feel strongly that communication is everything. And like I said before, sometimes it's the phone, but there's a Tiger Text has the ability to sort of like give you a high alert, and you better look at this right now. This is really, really important. And that's been just really, for me, really helpful, because I'll be honest with you, I've been working 7 days a week since this thing started, and
Right.
I have to figure out on any given day what's the priority. And if I get a priority message on Tiger Text, I know they're not fooling around and they need an answer right now.
Right. Terrific. That's great. And sticking with internal communications tools, you talked about MS Teams and Zoom, and that you used both. Is there a way you discern which ones you use, or which types of employees use one platform, or when you use it?
So listen, I'm into whatever makes people comfortable, right? So everybody has a different level of comfort with technology.
Right.
So if you've been using Teams and you really like it, we'll use Teams. If you prefer Zoom, we'll use it. There's an Adobe platform that I've seen, that works incredibly well. Everybody, it's like you've seen one social media platform, you've seen one social media platform.
Right.
Well, it's the same thing with this. If you've seen one, you've only seen one. They're all slightly different. And I wouldn't recommend one against the other. I would just say, whatever your comfort level is in your organization. Nothing works better for me as the chief operating officer than to send out a survey, a quick survey. I send surveys out a lot. Our whole company does, to just say,
How do you
is
do
this
that, Sandy? What tool do you use for that? Just an
survey,
email?
survey
Oh, you do
monkey?
Survey Monkey? Okay.
We do. As you know, it costs nothing,
Right.
right? And keep it short and sweet. 3 questions. Have you ever used Microsoft Teams before? Are you comfortable with it? Yes or no? Those types of things. And it's really easy to get the pulse of an organization that way.
Mm-hmm.
So, yes, so that works for us.
And then I'd like to go back to external communications. You touched on that and how vitally important it was during this time, and you work closely with the marketing department. Can you talk a little bit more about that and how it became so important at this time? I know we've talked in the past about support groups and works with school systems and such. If you could share that with the audience, it'd be great.
I'd love to. So, to me, one of the most important things that you can do as an agency, whoever you are, is to be transparent, right? Um, in my particular case, the thing that I worried about the most was our residents. I was worried that people would opt out of sending their loved one to the residence, thinking that they wouldn't be able to visit their loved one.
Mm.
We made a decision very early on. We're lucky that each of the 11 private rooms actually has its own entrance. So we said we'll follow the screening that's prescribed by the state, right? We will ask, people the questions we need to ask, take their temperature, et cetera. But we made a decision early on that we were going to allow visitors. So we got that word out instantly. We worked with our marketing department, we worked with our ad agency, and we made sure that that went out wherever it possibly could. And it was, front and center on our website where it needed to be. Now, like everything else with the pandemic, this kept changing and changing and changing, right? So week 1, we said, sure, we'll allow all visitors. Well, by week 3, we said, now we're starting to get worried because we're hearing more and more about COVID in the community. So we're going to limit the number of visitors in a 24-hour period. Again, had to get that message out, right? One of the greatest things that I've heard throughout all of this is from the families who use our service, who said that they just felt incredibly heartened and less worried when they saw those communications on our website or on social media, because it answered the questions that they were most worried about. Will I be able to be with my loved one during this time? And I will tell you that, I could just sob telling you this, the letters that I have received from grateful families who said, this made all the difference for us. We hadn't even been able to see our loved one for the 2 weeks before they came to you when they were in the hospital. We were having difficulty communicating, and somehow this was able to help us all have closure. So it's important to get that message out, right? Support groups. So very big part of what we do. I dare say that no one does it better, right? So we work on anticipatory grief. So we work with families who know that a loved one is going to die. And then we work with people for 13 months after their loved one has passed away. And a lot of the way we do that is through support groups. So again, pandemic throws us a curve. Can't meet in person. I got in touch with our director of social work and said, how comfortable would you be if I started pushing you towards an online presence? She said, let me think it through. Let me talk to my team.
Support groups online?
Yes.
Wow.
And I have to tell you, it's just, to me, one of the greatest examples of don't let all your biases get in the way. Of course, there's nothing like being in a room with other people, right? But what's the object here? The object here is to continue to offer this incredible service. And so we use the Zoom platform for that. And what's great about that is that you can turn the camera off if you don't want to be seen.
Right.
You can be a listener. You don't have to talk. Everybody has their different stages of grief. But we wanted to make sure that that was available to everybody in the community who had suffered a COVID loss. So we didn't limit it to just those who were in our care. And so surprisingly, some people took advantage of that really had no relation to us whatsoever. We also heard from some of the school systems, the hospital systems, nursing homes, that they were just totally overwhelmed with grief. They were caring for patients who, they had multiple bad outcomes. In many cases, staff member passing away. This is heart-wrenching stuff. And so because we kept sending those communications saying, we're here for you no matter what it is. If you need one-on-one, we'll be there. If you need a support group, we'll be there. If you need advice, we'll be there. And many organizations in the county took advantage of that. And we're really proud of that. And so we were able to use technology. Again, we didn't go out to the nursing home necessarily or the group home, but we were able to do it in a platform like we're doing today. And what an invaluable service to this community. Mm-hmm. So again, just rethinking how you do things. Is it ideal? We thought not, but it turns out that there are a lot of people who kind of aren't joiners, if you will. They would like to sort of remain anonymous,
Right.
and these platforms allow you to do that.
Sure.
We keep talking about virtual hugs. It's virtual everything at this point in time,
Right.
right? But I don't think we've lost the compassion. And for me, as the chief operating officer, one of the things that I really pride myself on is providing compassion the same way that we provide to our patients, to our own hospice family.
Mm.
These have been probably the most stressful times that anybody has gone through in their lifetime, right? And as an employer, I feel incredibly responsible for the well-being of everybody in our agency. And everybody responds to a crisis like this differently, and everybody has that. There's sort of triggers. So we had staff who had family members who tested positive for COVID, and needed to take some time. We had staff members who tested positive. We had people who've got small children that they were worried about childcare. So we said, let's rethink the way that we do business. Okay. We're a service that runs around the clock, 7 days a week, 365 days a year, no matter what. So if you're the parent of a small child and the only time that you can get childcare is in the evening, make your visits in the evening. Now, we've never done that before, right? We're primarily in 8:30 to 4:30 or the usual business hours. But we felt very strongly that we needed to work with our employees, whatever their situation was, because honestly, they're the backbone of the organization. And if we can't treat each other with the same compassion and empathy that we treat, the families that we serve, shame on us. I mean, at the end of this, we wanted to make sure that people understood that we were going to do everything in our power to keep you, the employee, as safe as humanly possible. And we can talk things through, right? What's your worry? And so we set up a number of forums where we would lead groups, individual groups of people. What are you worried about today? What's on your worry list? What is there anything that you think, a tool or something that you need that you don't have now that would help you to be more successful? And honestly, we were able to fix everything on the spot and take that stress off the employee, right? Because we want them to go out and do their good works. And, to me, if there's, one thing that I could stress upon your listeners today, your watchers today, is that nothing takes the place of compassion and kindness. Right. At the end of all of this, like what do we want the outcome to be?
Right. And
We
you don't
want
just mean with those that you serve. You're talking about with your staff, with your team.
absolutely. And I've heard I'm on a number of blogs and WebExes and what have you, and I have heard some pretty interesting stories about how people bailed, how they quit their jobs on the spot because they felt that their employer didn't understand the human toll that this was taking, and so. I didn't want that on my conscience. I felt very strongly that whatever we could do to accommodate people and their situation. So let's face it, is everybody 100% productive when they're working from home?
Well, of course.
Some people are 150%, and some people are 80%. But at the
Right.
end of the day, I'd rather have that 80% than have no employee.
Of course.
Right. So you find a way to make things work. And, nothing to me is more important than making sure that the morale of your employee is kept up and that they trust you. Trust is everything.
I'm so glad to hear you say that. And it certainly was a lesson that I learned through my experience on kind of this side of the equation with COVID, talking to so many small business people. There are a number of scenarios, just this incredibly bizarre situation we're all in, first of all. So it was a shock to all of us. But then you have the controversies over unemployment, over, of course, staff that weren't working, making a lot of money on unemployment. Good for them, but it posed a challenge with employers and employees. The controversy over the forgiveness of the PPP loans. My point is that ended up pitting employers and employees against each other to a degree, certainly not intended, but was an unintended consequence without question. And I found that the companies I spoke with, small and medium as well, that really cater to their employees, that will try to be understanding, have compassion, as you talked about it, and that side of it, that's something that's very easily lost in this because everyone, especially business owners, were just panicking and trying to deal with this. But those that really paid attention to caring for their staff, even if they were not working at that time, seem to be having the best outcomes because now they need that staff to come back. And that's been an issue anyway in our world, not to mention our country and here in Orange County, that everyone's looking for quality talent. They want to attract them, they want to keep them. It's hard to do. And so you've really shared a lesson that taking the right approach here, you've come out on the other side of this really where you want and where you need to be.
It's probably one of the most important lessons learned through this is, right, kindness goes an incredibly long way. I'll
Mhm.
be honest with you. There was some worry that people might not be as diligent about, their work. I haven't found that at all. Again, I told you I use this technology all day long. If I type or text any of my employees, I can answer back in 2 seconds. They're working hard. I believe the best in people until somebody gives me reason to pause. I truly believe that people are resilient. People want to do the right thing, and if you give them the opportunity to do that, it will come back at you just in every great way possible.
Absolutely. Totally agree. This has been amazing. Thank you so much for sharing your story, for Hospice's story. I'm trying to think if there are any other lessons you've talked to us about really how important it is for everyone to come together, talk out any problem you may have, work together on a solution. That's been clear. Talking about pivoting, I'll say, with compassion is important, not just for those that you serve, but vitally important there. Uh, People, I think, especially with your mission in hospice, maybe I think it was easy to believe that you couldn't deliver your mission the same way with compassion, doing it remotely. You showed that you did that as well. Anything else you want to share? I know when we first spoke, when we first introduced, you gave me a Mr. Rogers quote. Is that something you want to share with our viewers here?
I surely will. So I have thought about this over and over and over again. I read it in a book that he said that his mother gave him the advice that when he was a child, whenever he was worried or he was scared, she would say to him, "Find the helpers. They're
Mm,
there." I just gave myself the chill saying that, and it's so true. If ever there were a time in this inhumane period to prove that humans are resilient, this is it. The helpers are everywhere, right? So the lessons learned are important to be shared, but also when people are in the weeds, we have to depend on one another. This isn't a time when we should be competing. This isn't a time where we should feel like everything we're doing is proprietary, right? We're all small businesses. Our hospice is about a $13 million a year endeavor. We actually don't break even at the end of the year. The only way we break even is through fundraising, right? We had to pause our fundraising during all of this.
sure.
It's the right thing to do. We're certainly not going to hold a gala or hold a golf tournament or
No,
whatever. But we feel, that if we just continue to get the message out there that we need to do this all together as a community, in the end, the helpers will help the helpers, right?
absolutely.
We're all in this together, and we'll all come out on the right side of things. So look, who knows what's going to happen, right? A week from now, a month from now, 3 months from now. But the one thing that I would say, to put a punctuation point on is always examine your plans. Always, do a survey. We did this with our own staff about 2 or 3 weeks ago. We sent out a survey to our management team, sort of post the most emergency prone period of all of this, right? We're kind of coming towards a different, turn in this thing. And we asked them very specifically, what were you worried about? Did it come to fruition, right? What's the one thing that you would take away from this? And I'm just gonna tell you, to a person, they said that working remotely actually made them more productive,
Huh.
which
Heard
is
that.
very interesting to me.
So many times. Absolutely.
That the interruptions just weren't there. The other thing is that they feel like it made their own communication much more crisp because you're talking all day long. And so you've got to get to the point and make sure that the message that you need to deliver is delivered succinctly. And the
Absolutely.
other thing is that people just learn to lean on one another, right? If you know that somebody has an area of expertise that you don't have, you just need to, to ask for help. It's something that we don't do so well all the time, right?
I'm so glad that you said that. I don't know that our county executive, Steve Newhouse, is familiar with the Mr. Rogers quote about finding the helper, but that certainly has been his approach. That's why we're doing what we're doing here right now. That's why everything we've done in the county is set up and to streamline communications directly, social media, whatever it might be, these types of webinars. So it's been essential. We're proud to have done it. Thank you so much for being a part of it. It's incredibly fascinating what you share with our viewers today. Thank you so much, Sandy.
Thank you.
Two quick things as we wrap. One, how can people, if they're interested in finding out more about hospice or the work that you've done specifically, how can they contact you?
Sure. So we have a very easy website, hospiceoforange.com. It is not .org, it is .com, or 845-561-6111. And you can ask for me. I'd be happy to talk to anybody directly about any of this. This was a short period of time, you and I together. I'm sure both of us will think of a million things that we wished we had talked about today. Your listeners probably same thing. So pick up the phone, give me a buzz. Happy to talk to you. My personal email address is Sandy with an IC for Cassese at hospiceoforange.com. You can also
We'll post that as well. And Sandy, the last thing I want to ask is we'll have questions immediately after this broadcast, and then we'll be re-airing it. We get a lot of questions at that point too. So we'll reach out to you again and see if you can answer some questions from people that they posed, if that's okay with you.
I would love that. Have me back. I think this is a story that's just going to continue, to take some twists and turns. And if we can be of help to each other, we should definitely do that. And you know what? I'm really proud of Orange County, right? Think about, what we've been able to accomplish over the past few months. I think people need to take a few minutes and really say, you know what? We were in this together. We did things wisely, and we're better for it. And when the next wave comes, we will do everything in our power to stand together and stay strong.
Couldn't agree more. Sandy, you were terrific. Thank you so much. This was fabulous. Thanks for you, all you've done and all that Hospice of Orange and Sullivan is continues to do. And it's critical work. And thanks for being a part of this. Our business community really appreciates it.
Thanks. My staff are the real heroes. I just need to say that out loud. And actually, all of the healthcare community just deserves enormous praise from all of us. So thank you.
Thank you, Sandy. Thanks so much. Thanks for joining us.
Sure thing.
Take care. Bye-bye.
Bye now.
I think that was a terrific interview. I hope you enjoyed it as well. As we said during the interview, we're going to be taking questions after the re-air of this episode. So please submit your questions. You can either email them to me, put them on Facebook on the Orange County Economic Development page, where we'll be broadcasting the re-air for this. Sandy is available to answer questions as well. She's going to be taking those and responding also. So please submit those questions. We also got some during the live broadcast here, so we'll be sure to answer those as well. We want to thank you for joining us. This has been a very informative episode. We hope that you feel the same way. We ask you to stay in touch with us. We are continuing to progress through the various phases of reopening, and it's been an exciting time, but want to continue to remind you that you are not alone. We are here for you. We are getting through this together. So please continue to reach out to us, not only in my department, but again, Amanda Dana in tourism, Steve Knob, employment and training. We're all here to help you, and we have all the resources that you might need. So thanks for tuning in. Please share this with others who might need this information. And remember to tune in next week for our last episode, which is focused on marketing. So how to adjust, pivot, use technology, etc., to employ the most effective marketing strategies during this new environment. So thanks for joining us today. Make sure you tune in next time, and be well out there. Take care, folks.